If you or, someone is wrestling with BPH,
Benign prostatic hyperplasia.
right, you know the reality. The constant trips to the bathroom, the weak flow, and just the
Hmm.
sleepless nights. It's relentless.
Mm.
And when those symptoms get bad enough that medication isn't really cutting it, the conversation,
Mm-hmm.
it almost always turns to surgery.
That's a scary word.
It is. The
Mhm.
traditional option, the TURP,
Transurethral resection of the prostate.
it's effective, sure, but the recovery is so long. And frankly, the potential side effects around sexual function are a major deterrent for so many men.
That's really the core challenge. BPH is just, it's an enlargement of the prostate tissue.
It's just gross.
It grows, and that overgrown tissue clamps down on the urethra. That's what causes all that discomfort. But, like you said, technology has offered a profound alternative.
And that's what we're here for.
Exactly. Today, we're doing a deep dive into the source material on UroLift. Our mission is to break down exactly how this minimally invasive technique works, and then to compare its critical differences to the traditional TURP, and ultimately figure out who the ideal candidate really is for this approach.
So for you, we're tackling that central question. Is UroLift truly the right shortcut to relief? Especially when you weigh the benefits of, rapid recovery against the potential limitations.
Right.
All right, let's start with mechanics. The whole appeal of UroLift seems to stem from the fact that it's FDA approved to lift and hold that prostate tissue away from the urethra.
All right.
But the key part is that it does it without cutting or removing any tissue.
That's the fundamental difference. The ingenuity is just, it's incredible. You should think about it less like a surgery and more like a simple internal retethering.
Retethering.
A urologist inserts a small delivery device through the urethra, a totally natural pathway, and then places these tiny permanent implants.
And how small are we talking?
The sources describe them as being about the size of a grain of rice. Yeah. And you can imagine them acting like tiny, permanent curtain tiebacks. They compress the obstructive prostate tissue outward, pinning it open to keep that channel clear.
And because it's so elegant and so localized, the procedure itself must be pretty fast.
Incredibly fast. We're talking under 30 minutes, usually.
Under 30 minutes.
Precisely. And that speed, that's what allows the procedure to be done with only local anesthesia or maybe some light sedation.
So no general anesthesia.
Avoiding general is a massive clinical advantage, especially for older patients or anyone with, say, pre-existing heart or lung conditions. It makes full sedation risky.
And when you contrast that with a traditional TURP,
Hmm.
what's the time on that?
That's 60 to 90 minutes, and it requires general anesthesia. So you're not just saving time, you are significantly reducing systemic risk right from the very start.
Okay, so that brings us to the payoff.
Yeah.
The two biggest advantages of UroLift, especially if you lead an active life and just can't afford to be sidelined.
Mm-hmm.
The first one is undeniable. The fast recovery.
It's a stark comparison. The sources are very clear on this. After UroLift, most men are back to light activities in, 2 to 3 days?
2 to 3 days.
Days. Now compare that to the 4 to 6 weeks of serious recovery needed after a TURP.
That is a massive difference in downtime.
It's huge. We found a great anecdote about a 62-year-old patient, a man named Mark. He said he was back to gardening the next day. No catheters, no drama.
The next day.
That kind of immediate return to daily life is exactly what makes this a true game changer for so many people.
But then there's the second advantage, and for a lot of men, this is probably the most critical quality of life factor.
Oh, absolutely.
The preservation of sexual function.
This is where UroLift really sets itself apart. It explicitly preserves sexual function. More specifically, and this is critical, it does not cause retrograde ejaculation.
And can you explain what that is?
Sure. It's where semen flows backward into the bladder during orgasm.
Which is a very common side effect of traditional prostate surgery, right?
Very common. It affects a significant number of TURP patients, and it can be, emotionally debilitating. The fact that UroLift avoids this risk is a huge psychological benefit.
So putting it all together, it's a faster, safer procedure.
And it's typically done in a clinic, so you can avoid a hospital stay altogether. Now, some UroLift patients might need a temporary catheter, but it's usually removed within 24 hours. The difference is just, it's night and day.
All right, this all sounds almost a little too good to be true, which tells me there has to be a catch. UroLift can't be a universal cure for every single man with BPH.
You're absolutely right to be skeptical. This procedure really raises an important question. When is the quick fix not the answer?
Okay.
And the primary limitations are tied directly to the size and the severity of the enlargement. UroLift really works best for moderate BPH symptoms.
Moderate.
If the prostate has grown too large, and the sources are specific here, greater than 80 grams, those little implants just aren't strong enough to provide sufficient relief.
So if your prostate is just too big, this isn't going to cut it.
Exactly. In those cases, traditional TURP is generally the more effective and, frankly, necessary route.
Okay, so size is one thing. But what about longevity? We know TURP is pretty much a one-and-done solution. I've heard UroLift described as temporary. Is that fair?
That is the critical trade-off. Most men enjoy symptom relief for 5 or more years, which is great.
Sure.
But some of the data shows that maybe 10 to 15% of men might need a second procedure after just 3 to 5 years.
So why take that risk?
It's a cost-benefit calculation. Many men opt for UroLift precisely because they prioritize that immediate quality of life. They want to avoid weeks of downtime and permanent sexual side effects, even if it means a small chance of a minor repeat procedure down the road.
Beyond size, are there other specific conditions that would disqualify someone? You mentioned bladder damage from watchful waiting. What does that mean?
That's a crucial concept. Watchful waiting is just monitoring symptoms and delaying treatment until things get really bad.
Which a lot of people do.
They do, but the danger is that a severely blocked urethra makes the bladder work so hard for years to push urine out. Over time, this can permanently fatigue the bladder muscle. Think of it like a burnt-out pump.
And once it's burnt out.
Once that damage is done, even if UroLift opens the channel, the bladder might not have the strength to empty properly. So things like a very large prostate, existing bladder damage, or even urinary stones, they all rule UroLift out.
Because the problem is bigger than just the prostate at that point.
The whole system is compromised. It's also interesting, though, that UroLift isn't always a standalone treatment.
Right, it could be combined with other approaches.
That's right. For maximum benefit, it can be integrated with things like pelvic floor exercises, or even continuing some BPH medications like alpha blockers. It's a powerful tool and a much broader strategy.
Okay, so let's walk our listener through the practical realities. If you're an ideal candidate, what does that patient journey actually look like? It sounds a lot simpler than traditional surgery prep.
Oh, it's much easier. The prep is minimal. The biggest concern patients usually have is about discomfort.
Pain during the procedure.
Exactly. But because of the local anesthesia, you might feel some pressure, maybe a slight pinch, but generally no serious pain.
And what about after?
Post-procedure, there are a couple of temporary things that are totally normal. You should expect maybe a mild burning sensation when you urinate for a day or two,
Okay.
and some temporary blood in the urine. That almost always resolves completely within a week. Knowing to expect these things really helps manage any anxiety.
And the success rate we're seeing in the source material it's really compelling.
It is. The studies indicate a very high success rate. We're talking 85 to 90% of men reporting improved flow and reduced symptoms within just 2 to 4 weeks.
2 to 4 weeks.
Yeah, and the key markers they report at that 1-month follow-up are consistently a stronger urine stream and, maybe most importantly, fewer nighttime trips to the bathroom.
Getting that sleep back.
Exactly.
Now, since downtime is the whole point, let's really drill down on that. We heard about Mark gardening the next day, but that's light activity. What about the gym?
Right. So light, non-strenuous activities, yes, typically within 2 or 3 days. But the sources all advise caution with heavy lifting or strenuous exercise.
For how long?
It's essential to avoid anything really taxing for about 1 full week. You want to give the implants time to set properly and the urethra time to recover.
A short-term restriction for a long-term gain.
You got it.
Okay, finally, let's talk about accessibility. It always comes down to money. How is UroLift typically covered?
Fortunately, it's pretty accessible. Medicare usually covers it under Part B, which is a huge benefit.
Okay.
Private insurance is where you have to be more proactive. They often cover it, but they almost always require prior authorization.
And that can be a real headache, right? The
Yeah.
insurance company needs the doctor to prove it's medically necessary.
Precisely, and that can delay things. But
Yeah.
here's a helpful tip from the sources. It helps to know the codes.
The codes.
Yeah. Ask the urologist's office to specifically cite the CPT code 52441. Having that code handy just streamlines the communication between the doctor's office and the insurance company. It can really speed up that whole authorization process. So to bring our deep dive to a close, I think the final verdict is pretty clear. UroLift is a genuine step forward. It's a game changer.
But for a specific group of people.
A very defined population, yes. It's the clear choice for men with moderate BPH who are prioritizing fast relief, no sexual side effects, and minimal downtime.
So it effectively bridges that gap between medication that's not working anymore and that really drastic traditional surgical path.
Exactly.
But we have to reiterate that limitation. The whole decision is rooted in severity. If your prostate is deemed very large, that 80-gram threshold we talked about, or if you already have bladder complications, TURP is just going to be the more effective route.
It is. It's about the right tool for the right job.
And this leaves us with one final provocative thought for you to consider. We talked about how UroLift is unsuitable if the prostate is too large, or if that irreversible bladder damage has already happened from delaying treatment.
From that watchful waiting.
Right. And this highlights a real balancing act.
Mm.
How do you weigh that understandable desire for the least invasive option, like UroLift, against the critical need for a timely diagnosis? If you wait too long, you might actually disqualify yourself from the very minimally invasive solution you wanted in the first place. Those symptoms aren't just an annoyance, they're really a sign to consult a urologist before your options start to run out.